Middleton, Executive Director for the Center for Violence Prevention. And I am here with two rock stars from our Bridge Forensic program. We have Tiara Jefferson, who is our Bridge Operations Manager. Tiara, thanks for being with us today. And then we have Beth McCord. Beth is our nurse practitioner who is affiliated with us through her Family First Clinic here located in Pearl. So it's good to have both these ladies, and you all have worked really hard on everything we've done to protect victims and to work legislatively to make improvements. And so the first thing I want to do is just express appreciation to our legislature for the passage of the bills that we've been able to get done over the last couple of sessions. We have revised our statute on rape, and then the main thing that we're going to talk about today is providing the services for victims of sexual assault in our hospitals. That whole move came from the continued calls we were getting from around the state that victims of sexual assault and rape were being turned away from local emergency rooms and not provided any care, much less the opportunity to have the forensic evidence gathered. So this was a real problem, and it caught the attention of leadership and Representative Dana McClain and others who worked so hard to make sure that this came to be a reality. So Tiara, from your perspective as a SANE, tell me what you think this bill accomplished for victims.
So what I think this bill has accomplished for victims is it serves as a way for victims to always be treated, to always be seen. I know that there are so many times where victims may go to a hospital after being sexually assaulted and told that we can't do this here or we don't do this here. So with the new House bill being served, it ensures that every victim get served and get treated for sexual assault, and that is just so important for victims because they're already experiencing, so many emotions and so many thoughts running through their head after being assaulted, and to be told that they have to drive 2 and 3 hours over to the next hospital to be seen. I just feel like this bill plays a huge role in making sure all of our victims are treated fairly.
Thank you, Tiara. And Beth, as a nurse practitioner who you've spent days and days and hours in emergency rooms across our state, and you've done countless exams, what impact does this new law have on hospitals?
So I'm happy to be here and to talk about this and talk about this new law. I know there's a lot of mixed emotions regarding this law. I think it, has a very positive impact on the hospitals because it kind of forces them to acknowledge that there is an issue, that these patients do exist. And if you have one patient a year presenting to your emergency department requesting services, that's enough to have a program. That's enough to have somebody there who is educated and trained and able to provide the best care, the best trauma-informed care to this patient. And so I think it's a little push for the hospitals to have somebody there on each shift that is educated, or to be part of a program like our program where we can provide someone to come in and do the exam if need be. I think it also pushes hospitals to be prepared, so to make sure that they have the equipment there, the kits and things like that is needed to perform. A lot of our job as a SANE is education. We're educating the patient on what their options are as far as care goes, and so we won't necessarily always use all of the equipment that is provided or that the facility has with each patient, but having it and being ready is the most important thing.
Okay, so Tiara, we throw these terms around, SANEs and nurses and whatnot, and a lot of people out there don't really understand, what is a SANE?
So a SANE is a sexual assault nurse examiner who is at baseline a registered nurse and has received at least 40 hours of didactic training. And that training is based on the educational guidelines of the International Association of Forensic Nurses.
The new law requires hospitals to have proper refrigeration. I mean, we won't get into all of the details, but they have to have a proper refrigeration. They have to have a proper supply of evidence collection kits. And it also says that it requires the hospitals, the emergency departments, to have someone who is capable of performing the kits. So I know that it's our preference that it's a SANE, a sexual assault nurse examiner, because like y'all have said, they have all the training and the practice and the a lot of times the skills lab to go with that training, so that they know exactly what to do, how to treat a victim, and all the information. So how can it be that a hospital can have somebody who is not a SANE and yet still able to do the collection?
So any registered nurse can complete the exam. We've made it extremely easy for this exam to be completed. I know there are a lot of nerves associated with completing this exam. Nurses a lot of times think immediate they're going to go to court, and that's just not the reality in Mississippi. However, it's a simple, there's instruction sheets in the kit where you can read, and it tells you literally step by step, take the swab out of the plastic, moisten it with such and such. So it literally lines out everything. So a registered nurse is capable, with no SANE training at all, capable of completing this exam. There are different layers of education as well. So throughout our state, we provide some education regarding that. And throughout our state, we have people that are educating 4 hours. You can do let me just hit the top of what you need to make sure you're doing. So it could be as less as 2 hours. There's a 4-hour training. There's online training through the International Association of Forensic Nursing. And we're happy to meet your needs, whatever they are, in our service area, for people to feel more confident in doing the minimum of collection.
So one of the other things that was very important to us at the Center for Violence Prevention that the law included was that each hospital had the ability to form a partnership or to get an MOU with the service provider, such as we have here at the Center for Violence Prevention. So when in the Jackson hospitals or the metro hospitals, all except for the University Medical Center, when a rape victim presents or a sexual assault victim presents, the hospital will call here, the hotline, to the Center for Violence Prevention, and we will send one of our SANE trained nurses there to do the kit. And so that is an option that hospitals have. However, I think we're the only ones in the state that provides the MOU response, but hopefully we'll be able to broaden that response as time goes on, and it's our dream and goal to be able to form a database of all these SANEs across the state to be able to respond in a wider area. So let's talk about the timeline with the kit. So let's say a victim presents to the hospital, and whether it's one of you guys, one of our SANEs, or whether it's an RN at the hospital or a SANE at the hospital. A lot of our hospitals are getting SANEs now. So let's say they go in, they complete the kit. How long do they have before they have to call law enforcement?
So after the SANE or the nurse completes the sexual assault exam, they should immediately, but no longer than 4 hours, make that contact to law enforcement. And after law enforcement has been contacted, law enforcement has 24 hours to come and retrieve that kit from that medical facility.
And then on top of that, they have 2 hours to what, Beth?
Get it in the refrigeration.
To get it in proper refrigeration. So, and we tried to address a lot of these problems that we were seeing in the real world, where patrol for one jurisdiction may pick up the kit, and we just want to make sure that it doesn't ride around in the trunk for hours, and any sample that's in the kit could be damaged. So we want to make sure that proper refrigeration is addressed. One of the things that we weren't able to do in this legislative session was to create a reporting of where the kits are, who has the kits, because that's one of the things in tracking. In a lot of the other states, they've worked really hard to come up with a tracking method, so we would know, okay, Baptist Hospital has 2 kits, and they're waiting on whatever jurisdiction to come pick the kits up. So, that's the only way that we feel like we can really get a handle on if we have any backlogs, where are they? And so that, that will help us further identify the issues that we have in the process, because what we all want is for the kits to be done appropriately, for the kits to be processed in a timely manner at the crime lab, and for the investigators to have the information they need to make the case, and then finally for our DAs and prosecutors to do their job and take the case to court. Or, as you've seen so many times, Beth, you've done all these kits, and how many times have you had to go testify?
I have only testified 3 times.
And yet some of your cases pled out.
That is correct.
And so that's the power of forensics. When DAs can come to the table with forensic and DNA evidence that this perpetrator was the one, then it makes it much easier to move forward. And many times we see these cases pled out and they don't even have to go to trial. So the forensic kit is extremely popular and helpful in putting these people away. And we know that sexual assault offenders are characteristically felony offenders. This is not the first time they've offended. They are typically violent offenders. And so, this is good for the community and the society as a whole to be able to identify these rapists and put them away. And right now, I don't know if y'all remember, what is the statistic that we get from Rain about how many sexual assault offenders go to jail?
Well, right now it's less than 3% spend a day in jail.
So that's
and that's
3
out
out
of
100.
That's out of 100 rapes that that they look at, and half of those don't even get reported to police. It's less than 50 that get reported to police. I think the number is somewhere between 46, 47% that actually get reported to police, and from that number, less than 3 even spend a day in jail.
So that's a pretty shocking number, 3 out of 100. So, we definitely need to do better, and it's an opportunity for victims to find justice, and everybody who's experienced an assault or anything, any kind of criminal act, finding justice is hugely important in recovery. So Beth, what is the crime lab doing as far as tracking the kits at this time?
So right now, the forensics lab does have a way to track. We don't have true anonymous reporting, but this tracking system they have is a way to kind of lead into that. So right now, newer kits that we are getting actually do have a barcode and they have a number on them. We have a site where, as a medical professional, we can go on there and put that code in to signifying where we collected that kit. We can also chart, if you will, what jurisdiction we give that kit to. The next process would be law enforcement would go and they would log that kit in as part of their evidence. And then when they send it to the crime lab, the forensics lab will then log it in as saying that they have it there. The beautiful thing in this is that victims also can have access to that website right now. And so they can use that barcode number that they're given at the hospital, and they are able to go on that site and they can see in real time where their kit is. So if their kit is still at the forensics lab, it's going to tell them it's at the Mississippi Forensics Lab. If it has gone to law enforcement and never been to the forensics lab, it's going to say that. And so that gives them the power to call their advocate or call that jurisdiction and say, hey, boys, why y'all still got my kid over there? And so it's very helpful and it's empowering to victims to give them a little bit of piece of the pie to see what's going on with their kid. So that's important, and that's something that once the kit goes back to law enforcement, then they can call and say, okay, my kit came back. Do we have results? What do we have? Now, if you didn't get your tracking number from the hospital, your kit may have been one that didn't have it. As soon as it goes to the forensics lab, it is given a tracking number, and that is then uploaded into the system. So if you were not given that at the hospital, or you were not given that from law enforcement, then you can call law enforcement and ask them what that number is. And then you can call your victim services agency, and they will be more than happy to help you through case management to try to track that down.
So in talking about services for victims, we need to kind of talk about that as well, because the Center for Violence Prevention, through our Bridge program, offers all sorts of therapy and case management and advocacy to help victims of rape and sexual assault move through their process into healing. And y'all have mentioned several things that, that we're able to do for victims. We can go to court with them. We can sit with them in their interview. We have wonderful therapists, trauma therapists here on staff that can provide help. We also have some processing groups, which it's when our victims of sexual assault come together and actually work together to heal, and it's really impactful for those who participate in that. So now that the hospitals have all these new responsibilities, the Center for Violence Prevention wants to do our part to assist the hospitals to meet these new responsibilities that they've been given. So I mentioned earlier, so we're always glad to have Beth with us. Beth is a nurse practitioner, and she's been with us here at the Center for Violence Prevention for many years, helped us start our Bridge program. And we actually are now in partnership with your Family First Clinic, and we have a room down there in your clinic that victims can report directly to your clinic instead of going to the emergency room. So that's something that a lot of our local law enforcement really love. They call Beth and send the victim directly to her clinic, which avoids the whole hurried, crazy atmosphere that is always the case in emergency rooms. So that also is an option that we have for victims. So in an effort to assist hospitals, tell me what we're doing. I know y'all spent a lot of time planning together, and we talked a lot about the training and what's required. What happens next? Because when anytime you're talking about learning something new, when you read it and hear it and yet then have to go practice it on a live human being, a lot of times the connection is not really there. So what are we doing to help with that?
Yeah, so we're super excited. Started thinking about what is the missing link that nurses, after going through training, don't want to continue on, or they don't feel like they are able to complete an exam. And we thought the biggest part of that was a clinical skills lab. So Tiara and I both have had the opportunity to attend a clinical skills lab, and man, just how much more it adds to what you've just sat through for the didactic training. So anything in nursing, we may have the book training, but we're always going to have an opportunity for the hands-on training. And so the sexual assault nurse examiner training is much like that. So it's different in the fact that you don't get your certification afterwards, but that doesn't mean you're not a SANE. That doesn't mean you can't collect exams. And so the clinical skills lab piece gives that nurse a little bit more power. It kind of empowers them a little bit more to be confident in what they've learned and what they're doing. So the clinical skills lab is a 2-day session where we're going back over some of the didactic, anatomy, different techniques that can be used during an exam, different equipment that can be used, really just tying that didactic together with the physical exam piece. And so during those 2 days, we're going to be going over the kit, we go over anatomy, we go over Foley insertion technique into the vagina to look at the hymen. We're going to go over toluene blue, speculum insertion, all those things. And we get to go over that on live models. So that's super important because we can do a lot of things on the plastic and the simulators, but doing it on a real person when you are not in that patient's trauma response, when you're not meeting them initially after trauma, is huge. And it gives the learner, the registered nurse, an opportunity to really hone in on their skills in a safe place where they're not in the heat of the moment collecting these samples that can potentially, hurt the prosecution of a perpetrator. So it's a great opportunity for us to come together and share our knowledge. I'm so excited that we have the space at Family First Healthcare to do that. I'm so thankful and excited that we have the Bridge space. It is a community-based clinic. It's not owned by, a big entity. It is ran through the Center for Violence Prevention, which is a nonprofit. And so I don't believe there's another one in the state like that. And so I'm super excited that we have all of that at our fingertips to be able to teach these nurses the best practice and how to complete these exams, answer any questions that they have right there in that, safe place where they can ask all the questions and have an opportunity for failure, so that when they are in that moment completing that exam, they have no issues at all. I remember when I was trained back in 2012. My first exam after that was 6 months. And so it was foreign material again when I was looking at it. And so they didn't have, skills lab around here was not a thing. And so I was so thankful when we went to one, and then now having the opportunity to do one ourselves. I'm grateful and I'm excited for what it means for the state of Mississippi and our SANEs. So many times when you go into a ER and say, who's a SANE, nobody raises their hand. Then we say, okay, well, who's been through the 40-hour training? And then you see about 5 or 6 hands go up. But none of them want to do it. None of them feel confident in doing it. And so a clinical skills lab, it's going to be a game changer.
So Tiara, when is this going to be? Give me the details.
So our clinical skill lab is set to take off on January the 22nd and January the 23rd from 8 a.m. to 4:30 p.m. On those days. And like Beth said, we will have live GTA models where the nurses can practice and, feel comfortable collecting evidence and viewing the female anatomy. Because I know once I've responded to a few hospitals, I've heard nurses who have had to do the exam and they've had the same training, but they still were not comfortable because although they had the clinical skills lab before, they haven't have enough consistent training to feel comfortable collecting the evidence. So that's when it will be. I look forward to any nurse who have had the same training to come to this clinical skill lab and receive that hands-on piece of becoming a SANE. So it's something that we're really excited about. And I want you guys to look forward to us coming to our local hospitals, Baptist, Merit Health, and St. Dominic's to talk about it a little bit more and find out what nurses, want to sign up for the clinical training.
So you can watch all of our social media for the registration links for this important training. And this is a standards-based training that we'll have 4 of our U2 and then 2 more of our sexual assault nurse examiners there who will be serving as instructors. And again, as they both said, we're really excited about it. We think this is going to make a difference for our hospitals and also for the victims we serve. Ladies, thank you. Thank you for your commitment to serve victims. Thank you for your hard work and your dedication and commitment to victims. Thank you.